So we're going on now to Part 3. What help may be available for individuals under age 65 to pay for Medicare? I will go through this section fairly quickly. I want to familiarize you with it. I want you to have it as a resource. But again, many of you are experts in the Medicare savings programs and the low-income subsidy. And this will also be covered in our next webinar in this series, Medicare for duly eligible and low-income people, that will be presented by our colleagues at Justice and Aging. Medicare savings programs provide assistance with meeting some or all of the costs of Medicare premiums, deductibles, co-payments, and co-insurance. They are typically based on federal poverty levels that are updated every April 1st. And states and territories and Washington, D.C. may alter Medicare savings program requirements. For example, here Connecticut has eliminated the resource or the asset test. Washington, D.C. has raised the income eligibility for the QMB program from 100% to 300%. So there are some variations, but the vast majority of states use the federal guidelines. States and Washington, D.C. with revised guidelines include Alaska, Connecticut, D.C., Hawaii, Maine, Minnesota, and Virginia. So if you are in one of those states or in Washington, D.C., you will, if you are not already, which I'm sure most of you are, want to be familiar with your own guidelines. The Medicare savings programs and the low-income subsidies are detailed over the next 5 slides. But what we're going to be looking at, and again, I feel that most of this is just review for many of you, are the 4 different MSPs and low-income subsidies. So the Qualified Medicare Beneficiary Program, or QMB, and just as a comparison, I'm going to go through the percentage of the federal poverty level in each of these programs, what the program actually pays for, and then just a quick look at the monthly income limits and resource limits. And again, these are subject to change in April of this year, April of every year, and that limits, again, may vary, as I just mentioned, by state or Washington, D.C. So the QMB, or Qualified Medicare Beneficiary Program, considers up to 100% of the federal poverty level in the vast majority of cases. It pays all cost sharing, including premiums, deductibles, co-insurance, and co-payments, and you see the monthly limits there. Again, these are the standard numbers that are used by most states and territories on both the monthly income limits as well as the resource limits. In comparison, then there is a program, the Specified Low-Income Qualified Medicare Beneficiary Program, often referred to as SLIMB, which is 100% to 120% of the federal poverty level, that helps to pay for the Part B premiums. The individual must be eligible for Part B. And again, we have increased based on the up to 120% of the federal poverty level, the monthly income limits and the resource limits. The QI program, or the Qualifying Individual Program, is satisfied by 120% to 130% of the 135% of the federal poverty level. Also helps to pay for Part B premiums. This is an annual application, and priority is typically given to those who previously received benefits under the Qualifying Individual Program. There is no QI if the individual is Medicaid qualified. And again, the resource limits. And again, I will caution on each one of these programs, if you're in one of those states that doesn't follow the typical track, be careful of what advice you're providing. The Qualified Disabled and Working Individual Program, QDWI. I'm going to focus a little bit more on this one because this is very important to the population that we're looking at here with individuals who are under the age of 65. It's assistance for up to 200% of the federal poverty level. It helps to pay for Part A premiums if that's necessary, and may qualify if the people may qualify for this program if the following apply. It's a person who is working, disabled individual under the age of 65, who has lost premium-free Part A because they have gone back to work. They're not getting any state medical assistance, and they meet the income and resource limits that are required by the state. So again, these are the federal levels that are adopted by most states here on this particular slide. The low income subsidy is for all or most Part D or prescription drug premium and cost sharing. People are automatically eligible if they have Medicaid or a Medicare savings program. They are auto-enrolled to Part D low-income subsidy, sometimes referred to as extra help. And it will be retroactive to the date of the Medicare savings program entitlement. It will also be available for people who don't qualify under the first part of this. They're also available for individuals on a sliding scale with income up to 150% of the federal poverty level and with resources there as noted. So again, this is really helpful for people in getting access to prescription drugs.